Some introductions here. My name is Becky Sanders. I am the Program Director for the Upper Midwest Telehealth Resource Center. And today we have a couple of other UMTRC staff helping out. Carolyn, would you like to introduce yourself?
Hi, my name is Carolyn Miller. I've been with the company for 5 weeks now.
Awesome. And Carolyn is our data assistant and helps us keep everything on track and does all of the registration work for all of the webinars and virtual office hours that we do. Cam?
Hello, my name is Cameron Hilt, and I'm the Data and Evaluation Coordinator for the UMTRC.
And Cam, once we get started here, Cam's got a 2 to 4 question survey that he's going to put out so we can get a little bit of feedback on today's session. And Joe.
Hi, I'm Joe Olery. I'm part of UMTRC working with the COVID grant, and I was brought on board to help develop patient and provider resources aimed to educating on telehealth and how that can be utilized right now with COVID.
Thanks, guys. Cam, do you want to go ahead and pop that pre-survey into the chat, and that'll help us, if you guys could go to your chat and click on that link, that'll help us to give us some live feedback about your role in your organization and your knowledge of telehealth and where things stand. Do we have any results yet? And I'm going to give you, Cam, the opportunity to, oh no, I can't. Carolyn, you may have to do that to make sure that Cameron can share his screen. Will it allow you to share your screen, Cam, and show those results?
Yes, now it will.
Okay.
1 second.
All right, so we've got a provider, an FQHC provider that's been doing telehealth for more than 1 year. Or both of you, looks like, have been doing telehealth for more than 1 year. Am I reading that correctly, Cam?
So that's only the one response.
Okay. All right. Joe, did you want to go ahead and share some of the resources we've developed?
Yeah, sure. Like I said, I work on developing patient resources and provider, although I've mainly focused on patient resources. But here is just a basic telehealth workflow, and what the aim of these resources that I've created is to just help physicians and providers, and even with some of these patients, just to get a better understanding of how the telehealth flows and what to expect when providing care through telehealth. And this is just kind of a general overview of what that might look like, because obviously a lot of this will depend on what state you're from, what hospitals you're associated, and what you're allowed to do and not do. And it also depends on whether or not you're providing telemedicine appointments from provider to patient home or provider to a local telehealth clinic where the patient comes into that clinic and will be seeing a telehealth coordinator or nursing staff who helps set up those appointments and sees the provider from there. So this just kind of gives a light overview of that. And also down here, what I did was I provided a link to our partners at the California Telehealth Resource Center. They have a lot more detailed workflows that are more specific for certain situations. So when people come here, they can get a general overview. And when they're looking to identify something more in depth, they can click out to that. I also created a general, basically just a data sheet on telehealth. And what this is for is to help those providers who are new to telehealth to understand the increased usage and the potential and how patients feel about it. So I have just a lot of general statistics on consumer and patient usage, as well as detailing the use for Medicare users, because this is really the population that was using it most right away at the start of the public health emergency. And so just how users who we wouldn't normally think would be utilizing advanced technology like this to receive care were some of those who could receive the most benefit from that, and those who were some of the heavier users. And then also just touching on some of the finances on it, how it's both beneficial for the hospitals and how it is predicted to be an extremely market that is growing drastically, as well as just when patients would want to use it, because some, depending on what type of care is being provided, it may be extremely beneficial for those providers, and others maybe not so. Maybe there's not as much of a market or benefit to providing care through telehealth. And then lastly, let's pull this here. This one is specific to telebehavioral health, and I'm working on creating more of these resources that are specific to different specialties. And this is really good for patients too, but it kind of breaks down what telebehavioral health is, and shows kind of some of the statistics for it and how telehealth can be very beneficial within this specialty. And so it can just help providers utilize some of this data to recognize why this patient population could benefit, and how it increases their access, how it can reduce stigma, and how even going further outside of the public health emergency, how telemedicine can be even continuously beneficial for these types of patients, even when they could have the ability to go back in. It kind of gives patients that preference that's talked about here, to be able to choose how they're wanting to receive that care. And so it just kind of helps providers get an understanding beyond just the care that they've been providing in this specialty and how it relates specifically to telehealth. And like I said, it's also used, patients can use this as well. And this one was designed a little bit more with patients in mind, as you can see down here, just for telebehavioral health and telemental health, how important that is in linking patients to other resources outside of ourselves, where they can find help and reach out, and helping patients and providers identify what are some of these obstacles to receiving behavioral health, and how telehealth can touch on some of those. So our provider resources are still being developed, and there's some more that are planned, but really in general, it is just, providers know how to provide the best care, and telehealth is still very new to many of them. And so just helping them fast track to better understanding telehealth and incorporating that into their care, and helping them just put the right foot forward so that they're extra prepared to utilize this new knowledge and this new form of care. And I'll send it back over to Becky.
Thanks, Joe. I appreciate it. And Cam's going to send the link. All of our resources are available on our website under umtrc.org resources. Excuse me. So that link is in the chat as well. So this is the time where we really want to focus on an interactive discussion here to answer your questions. Can you tell us more about what it is that you do? Anything that we can answer for you to help make your programs more successful and sustainable?
Well, I'm going to jump right in there. My name is Juan Pacheco from Cincinnati. I work for a networking company. I'm originally from Virginia, and in 2000, I wrote a paper on telehealth. At that time, it was just starting out. It didn't take off, but it's going to take off now, even though there's not a lot of people here. There's a lot of doctors and doctors' offices that are confused. They know it's there. They don't know how to get started. And that's really the reason why I'm attending all these conferences. That's why I joined this organization, is to find out what resources are available. How can we get these providers, especially rural providers, even though I'm in Cincinnati, to get started? They're afraid of the costs. But they're concerned for their patients. And I see the branch off into mental health. And that's curious to me because I'm more into the clinical aspects, how to make sure that people with diabetes, people on dialysis, and people keeping track of these patients that are homebound because of the pandemic. How can we test them? And one of the things that I flagged, I know I'm going on and on and on, is telehealth clinics. I would like to know a whole lot more about telehealth clinics. Should Cincinnati Health Department and other county health departments start looking at providing telehealth clinics for the people during the pandemic if we're going to be in it for a while? And I could go on and on and on, but I'm going to be quiet because Shaka might have something to follow up with.
Sure, I will. I'll show you a couple of resources that you might take a look at. And so, Juan, are you working for the Cincinnati Health Department now?
No, I am not.
Okay.
I'm working for a private company and we're subcontracted out to different health departments.
Okay. So if you are working for a clinic, what I would tell you is to reach out to the Ohio Rural Health Association, to the Ohio State Office of Rural Health. There is another association, the Ohio Association of CHCs, or Community Health Centers. And I'll look these up and put these links in the chat here. There are a lot of organizations that are, let me share my screen here. Screen one. There are a lot of organizations working on that, and nonprofit healthcare associations helping clinics to implement telehealth. So this one, the first one is the Ohio CHC, Community Health Clinics. And then from a state level, when you talk about rural areas around the state, the Ohio State Office of Rural Health is a great organization, and I'm actually working with them right now to develop some training for early 2021. And then the last organization is the Ohio Rural Health Association. Other opportunities for legislative advancements would be to work with the Ohio Hospital Association. They do a lot of work around legislative affairs, and they would be good to work with. And then the other one that comes to mind is, let's see, Ohio, what do they call themselves? I think it's Policy Institute of Ohio. Health Policy Institute of Ohio. And they work on policy issues. So right now with the coronavirus, we are experiencing so many waivers that are making telehealth so much more available to patients and to clinicians to get reimbursed for providing services via telehealth. Right now, many of those waivers are ongoing. I can't talk and type at the same time. Institute of Ohio. Health Policy Institute of Ohio. The waivers are we're seeing record numbers of patients and providers use telehealth because of the waivers that make reimbursement easier. Right now at the federal level, the waivers go into the end of January of 2021, and many states are following along with their waivers as well. It won't be until December that we'll know for sure what Medicare is going to do as around policy and reimbursement for telehealth for 2021. But our expectations is that they will continue many of the waivers and make them permanent in Medicare reimbursement. And then many states are following suit. In the state of Ohio, their Medicaid program actually started allowing patients to be at home and receive telehealth services as early as July of 2019. And Ohio has had some hearings here in early October and looks to be expanding their permanent Medicaid programs to allow for patients and providers both to be at home and also for occupational therapy, physical therapy, and speech language pathology to be reimbursed via telehealth. So I hope that helps, Juan. I know that was a long answer.
That was a great answer. It helps a lot. So we're also looking at speech pathology and language pathology as well as the regular chronic illnesses that are putting people at risk because of this corona lockdown. That's excellent. Now, is there a state agency that we can write to get a list of these information, or do we have to write to each one individually? Or are you guys going to work on a list, you know, a flyer or a list that we could give to different clinics or doctors' offices that are trying to get together to get the funds to invest in this? And they're also concerned about, you know, the last conference we had addressed the HIPAA and privacy. So their doctor's offices are concerned with that. They're concerned with patients that don't have access to the internet or that don't have the equipment. But then a lot of people who are working from home now have the equipment. So the ones that are working from home, they already have a jump start on this. Can you address, or did I say too much?
I mean, that's what we do. Those, as a telehealth resource center, we're kind of like virtual librarians. So I would encourage them to contact us to look through the resources on our website. We have an email and a phone number on our website that folks can call and get in touch with us and ask their specific questions.
Okay, do we have a list on your website
A list of what?
of how to apply for a waiver or how to apply for a grant to
Oh,
jumpstart this?
we do have a section on grants. Individual practices don't have to apply for waivers. The waivers are statewide.
That's good to know. Thank you.
We got just a couple minutes left. Any other questions from anyone else? All right. As we start to wrap up today, I want to thank you for participating with us. And I'm going to ask Cam to put our final post survey into the chat. Joe, any final words of wisdom?
No, just thank you, Becky, for letting me do these and start getting the word out about some of my resources. And yeah, feel free to look at the patient resources there as well, and just send those around as you feel people need them and could use them and can benefit them. They're there for everyone to look at and use. So yeah, please feel free to share those around.
All right, last call for questions. Cam, do you have that post survey or do you want me to pop that in the chat? May have had to step away. All right, so I'm going to go ahead and post the survey. All right, if you would, and this is just a 4-question survey. If you would just take a minute to complete that, we would appreciate it. As we are federally funded, we do have to report to HRSA on our activities, and we appreciate the feedback so that we can continue to provide needed resources in our 4-state region of Illinois, Indiana, Michigan, and Ohio. So thanks for joining us today. Take care. Have a happy Halloween.
Thank you, Becky.